Namaste to everyone. A very happy Women's Day. Myself Dr. Shilpa Rani, Assistant Professor from the Department of Prasuti Tantra and Stree Roga, SDM College of Ayurveda, Hassan. I take this opportunity to discuss about the health, hygiene and behavioral changes in teenagers and young girls. A small girl playing with her friends, going to school with them, gradually stay back from her fellow friends and pals and stop going school with them because of her natural changes like breastfeeding, axillary and pubic hair growth, onset of menstruation, some type of fatigue, etc. Before she noticing all these changes and develop fear, she should be educated about the menstruation and allow her to cope up with all the changes. She is made to understand that puberty is a natural phenomena and every woman every woman should enter into that phase like her grandmother, mother, aunt, teacher, etc. She is need to understand that home is the first school and mother is the first teacher. I emphasize all the mother to educate her about the menstruation, maintenance and using of the sanitary napkins and hygiene maintenance during the cycle and dietary aspects during the cycles and so on. After menstruation also she might face some of the problems that she finds difficult to share with the friends and others. That is PMS, that is premenstrual syndrome, which includes both the psychological and somatic symptoms like abdominal bloating, breast tenderness, psychological symptoms like anxiety, depression, increased appetite, irritability, etc. which shows there is an involvement of both the mind and body accordingly. That too, she faced these symptoms 7 to 10 days before the onset of menstruation and she is absolutely symptom free during the rest of her cycle. In that aspects, the parents or the guardians present around her are very necessary to notice all these changes and bringing her notice and allow and encourage her to cope up with that. In that aspect, if she noticed these changes along with any other symptoms or it is disturbing to her daily routine, her education and on, it is very necessary to bring if she presents these symptoms, these psychologically and somatic symptoms along with any systemic illness, it is very necessary for the medical intervention and lifestyle modification and she may seek a medical professional. In that aspect, Ayurveda plays a major role as the aim of Ayurveda is to bring some psychological and somatic balance or psychological and physiological balance in an individual. It says Samadosha, Samagni and Samadhatu Malakriya and bringing the prasannata of Atma, Indriya, Manas. As Ayurveda include different chikitsa modulations like Yukti Vapashaya, Daiva Vapashaya and Sattva Vajaya, we can include Yukti Vapashaya and Sattva Vajaya in a single setting. As this Ayurveda is the better choice in the treatment of PMS, premenstrual syndrome. Thank you. I thank Head of the Institute and Media Department for their cooperation. Thank you all.